Hello, this is Andrew Van Ness with the English translation of Dr. Catalina Mendez's presentation titled Obturation, Its Basis, Objectives, and Techniques, originally recorded in her native Spanish. All of us are aware that clinical success depends on how we perform each step in endodontic therapy. Success starts with making a proper diagnosis. Once it is determined that a root canal should be performed, it is essential to find and gain access to the canals and to be able to isolate the tooth with a rubber dam. None of them meet the requirements set for an ideal irrigating substance. What are the ideal properties of a root canal irrigant? When we talk about an irrigant, it is important to recognize that these substances have specific characteristics that many other substances used in endodontic therapy do not have. It should have low toxicity. Some clinicians consider that a small puff of root canal filler extending beyond the working length is indicative of a fully obturated canal space with a well-sealed apical constriction. Subobturation. This denotes no root canal filling in the extension or length of the prepared canal. Just like the case with overextension, subobturation can be a cause of treatment failure. Modifications of warm vertical condensation will be discussed. Changes in manual obturation techniques will also be discussed, along with changes in thermoplasty techniques. The lecture will conclude by highlighting how obturation systems are managed today. Another drawback of gutta percha is that it can become brittle, as seen in this photo. Let's compare pluggers to spreaders. This slow insertion permits the sealer to disperse coronally. This ray demonstrates the final fill of the second molar. Note the obturation of both molars. This is a successful 5-year recall on both molars. This concludes the lecture on obturation of the root canal system.